What on earth is she insinuating there? And why on earth did chronically ill and disabled people get brought up into this conversation yet again? This was about weight loss surgery and the reasons why people chose to have weight loss surgery. And now she's bringing up chronically ill and disabled people to what? Use us as a prop to prop up her argument? Hello and welcome. Thank you so much for joining me today. My name is Katie, and for those of you who don't know me, I used to weigh 360 pounds, and I've lost 180 pounds and kept it off for years now. And on this channel, we will discuss weight loss, weight maintenance, nonsense I see online about body positivity and fat acceptance, my experiences with all of that, and well, anything else I feel like talking about. So if that sounds like something you're interested in, please go ahead and hit that subscribe button down below, and let's get into today's video. So today I have several TikToks for us to get through. The first one is from our friend to the channel, FierceFatFemme. And this is a follow-up to her response to Remy Bader and her weight loss surgery. And then I have several TikToks regarding Ehlers-Danlos syndrome. And since May is Ehlers-Danlos syndrome awareness month, I figure we'll go ahead, watch all of these together, and I'll give you my reactions along the way.
So many people in my last video were like, I didn't want to get weight loss surgery just because I didn't want to deal with fat phobia. It's because I wanted to get healthy. And here's my follow-up question. What does healthy mean? Truly, what does healthy mean?
Okay, so it appears, like I said, this is in response to the revelation of Remy Bader having weight loss surgery. And our friend made the claim that people were willingly choosing weight loss surgery and the potential side effects and complications of that, as opposed to dealing with fat phobia. And in my response to that, I said that that was a false dichotomy, that that's not the reason that I chose to lose weight. It's not the reason I've ever heard of anyone give to lose weight. I've heard lots of people give their responses as to why they chose to lose weight. They did it for health reasons. They did it for their looks. They did it because they wanted to find clothes. Whatever the reason is, it's valid. But fat phobia, that's one I have yet to come across anyone ever tell me. It certainly didn't weigh into my decision to lose weight. And when I read through her comment sections, there were a lot of people discussing that very same thing, that they didn't think at all about fat phobia when they were choosing to have weight loss surgery or choosing to lose weight. It wasn't even a thought in their mind. And she has it listed as, it's not just because of fat phobia, when, like I said, it wasn't even a thought in my mind. And reading through that comment section that she's responding to, it doesn't appear that it was a thought in most of the commenters' minds either, at least not the ones that I saw. And so I'm genuinely curious, why does this need a follow-up question? She made the assertion that people are willingly choosing weight loss surgery to avoid the effects of fat phobia. And when she was told that wasn't the reason why people chose to have this surgery, she doesn't just listen. She doesn't just learn. She's got to then, ask more questions? I mean, I hope she's asking these questions to actually learn and understand and not just try to persuade people to her point of view. And then her question of, what is healthy? Well, my definition is living the best quality of life that you can for as long as you can. And I understand that none of us are going to make it out of this life alive. I understand that if we live long enough, we're going to probably have some effects from aging and reaching certain milestones in our life, right? But it all comes down to quality of life and achieving that quality of life for as long as you can. But let's see what she has to say about this.
And it's different for all of us, but I think the problem is that everybody keeps thinking that healthy has a universal definition and it's applying it to everybody all around us.
Okay, so she said that health does look different on all of us, which I agree to some capacity. For example, if you're an 18-year-old athlete, health is going to look very different on that individual versus an 80-year-old grandparent. Those are obviously going to be very different situations in life, right? But I also look at totality of things, just general universal things. And she said there's no universal definition of health. Maybe not, but there are generally accepted things that are considered healthy no matter your age, no matter your ability, no matter what, essentially. Things like not smoking, that's going to be considered healthy. Either not drinking or drinking very moderately, that's going to be considered healthy. Getting enough restorative sleep, that's going to be healthy. Drinking enough water, definitely going to be considered healthy. Participating in low impact exercise, that's beneficial for pretty much all age groups. Maintaining a healthy weight, that's going to be one of them too. I understand there's no universal definition of health and that it can look differently on a lot of different people. I understand the point she's trying to make there. But I don't think anyone's definition of health is going to include being 100 or 200 pounds overweight. Just as their definition of health isn't going to include somebody who might be 50 pounds underweight. They'll admit it on one extreme, but they'll never, ever admit that being morbidly obese can have health effects for a lot of people. And that by its very definition, if you are morbidly obese, you're probably not healthy. Just realistically. So I do understand the point that she's trying to make, that we're all going to have our own different perspective on this, and where you're at in life might color what you view as healthy. But I don't think anyone's definition is going to include being morbidly obese.
That needs to be looked at and understood to say like, your healthy might be entirely different than my health.
And again, no one's healthy should include being 100 or 200 pounds overweight. Just like it shouldn't include being underweight either. There is a happy medium. That's why there's a healthy weight range. You don't even have to stick with just one number. You can fluctuate. I mean, like for my height, I can fluctuate like 25 or 30 pounds and still be in the healthy weight range. And even if I go 5 or 10 pounds above that, it's not going to cause massive health effects or anything. But once you start getting to 50, 100, 150, 200 pounds, it gets really difficult to try to ignore the impact that your weight does have on your health. I know at 360 pounds, I know I've listed them before, but I'll go ahead and list them again because it does bear repeating. I had symptomatic untreated PCOS. I had high blood pressure. I had obesity-induced asthma. I was pre-diabetic. My joints hurt all the time. I was out of breath just walking to go get the mail. I could no longer bend over to tie my own shoes. And while I understand that wasn't a health ailment, it certainly was a quality of life ailment. And again, if I'm going to go with my definition of healthy, where you're living the best quality of life you can for as long as you can, not being able to tie my own shoes certainly didn't fit in with my definition of healthy. So her trying to make these points that everyone has a different definition of healthy and that health can look different on everyone. It really does feel like she didn't ask that question to actually learn or understand. It seems like she's asking that question rhetorically, so then she can just turn around and try to double down on her point.
And also a hot take that I've been saying for years and lots of people have been saying, health is not guaranteed.
That's a hot take. It doesn't seem at all like a hot take to me. That just seems like objective fact. Of course, health is not a guarantee. Maybe I'm just acutely aware of this because my dad passed away when he was 52 and I was 19. He went to work and just didn't come home. So maybe I'm just acutely aware of this. Maybe I've just had enough family members that get a call about a diagnosis that they didn't have the day before and now they do. Or I don't know, I've walked outside and gotten a cold or a flu. Unless she's meaning this as some sort of gotcha or some sort of threat. Why would that be a hot take? It just feels like objective fact to me.
It is not something that everybody can have. So somebody who's chronically ill, disabled, whatever it might be, will not be seen as healthy. Therefore, are they not allowed to have a wonderful life without harm?
What? What on earth did she say? Are chronically ill and disabled people not allowed to live a wonderful life without harm? What on earth is she insinuating there? And why on earth did chronically ill and disabled people get brought up into this conversation yet again? This was about weight loss surgery and the reasons why people chose to have weight loss surgery. And now she's bringing up chronically ill and disabled people to what? Use us as a prop to prop up her argument? To try to give her movement some sort of credibility? Is that what she's doing? Because personally, that's what it feels like she's doing. If I'm being honest, one of the things that I do agree with body positivity and fat acceptance is when they say that people who talk about their health don't actually care about their health. That random strangers on the internet will make the comment, but what about your health? And realistically, does that stranger actually care about that individual that they left that comment on? And oftentimes they don't. They're just using it to dunk on that person. And that's kind of exactly what it feels like they're doing right now to chronically ill and disabled people. Oh, but what about your quality of life? Does she actually care about my personal quality of life? Or is she just using this to try to make a point? Is she just using this to try to dunk on people? It's no different in my viewpoint, honestly. So if they don't want people policing their health, I don't want, nor do I need her sympathy. I also don't need her to speak for me. I'm very capable of speaking for myself and speaking about my experiences as being chronically ill and disabled now. I am more than capable of speaking for myself, as are the vast majority of chronically ill and disabled people. Now, I know that no group out there is a monolith, and the same is true with the chronically ill and disabled communities. So, what I'm about to speak on here, I know might not apply to everyone within the community, but personally, I don't want people's sympathy. I'd like their empathy and their understanding. That'd be really nice. Kindness, sure, but I mean, doesn't everybody want kindness, right? Doesn't everybody also want empathy and understanding? Sympathy, though? No, I don't personally want it. I don't need people to feel badly about my situation. It doesn't help anything, honestly, at all. And as a matter of fact, when you are chronically ill or disabled, at least again, personally, when I do get people's sympathy and people feel terribly or feel bad, it can almost make me feel like I'm a burden to them. And I know that the people in my life that have expressed that to me, that is very well meaning. They definitely did not mean it in that way. But when I hear that coming from strangers, when I hear that coming from people on the internet, I don't find it to be well meaning. I don't find it to be coming from a place of actual genuine concern. I feel like I am a pawn being used as some sort of prop in her argument, and I don't like it. I absolutely despise the fact that they bring up chronic illness and disability all of the time in fat acceptance and fat liberation. They conflate these groups so much. And I definitely understand that there can be an overlap between the two groups, that you can have individuals who are chronically ill or disabled and also be morbidly obese and be a part of fat acceptance. I definitely understand that there can be overlap within that. But there are a lot of individuals who do not fall in both categories. They fall in one or the other. And so trying to lump us all together as if we all have the same needs, as if we all have the same desires, and as if we are one monolithic group, I very much disagree with that. I know even within my own support groups for Ehlers-Danlos syndrome, and that is just one chronic illness that exists out of how many out there, right? We're going to have wildly different experiences, wildly different opinions, wildly different ways of managing things or treating things, all because we do experience these things differently. I know, like with EDS, it's a spectral disorder, so there's a lot of overlap between our symptoms, but there's a lot of things that we might not experience the same. So I feel like that is very much what's going on here, that they want to just lump in chronic illness and disability in with their fat liberation and in with their fat acceptance, despite the fact that there's only a little bit of overlap and there are plenty of us that don't fall under both categories. So that really rubs me the wrong way. And another thing that really does rub me the wrong way about being lumped in with fat acceptance and fat liberation, being a chronically ill or disabled person, I work tirelessly to try to keep my condition from progressing. There are a lot of things that I do have to do to try to keep my EDS at bay or to try to stop flare-ups and prevent them before they happen. There's so much that I have to do. I have to watch what I eat. I have to follow a low inflammatory diet so that way I keep inflammation at bay. I have to drink tons of water. Of course, we all try to drink lots of water, right? But with EDS, you often have comorbidities or other conditions that are very common alongside of EDS. And some of the other conditions that I have alongside of EDS, I've got to drink even more water than the average person and more water than most people would even think is possible or necessary. But I really do need to drink just a lot of water all day long. Then I've got to make sure I get lots of sleep, and not just lots of sleep, but lots of good sleep. So how can I get good sleep? I need a cervical pillow to make sure that my neck is supported. I need to make sure I have body pillows and other ways of being supported on my mattress. I need a good supportive mattress. I need to make sure that the temperature is right in the room. I need to make sure that the cats aren't climbing all over my face. And that one I'm really struggling with. But there's a lot of things that I have to do even just to get good sleep. Then I have to stay as active as I can when I am able to. So when my body allows me to, I need to walk as much as possible. I need to stay up on things like housework and yard work and running around and playing with the kids, because all of those things allow me to continue to do those things. I mean, my absolute favorite form of exercise, it's coming so close. I can't wait. You have no idea, guys. We are so close to being able to get my pool up. And swimming is one of my absolute favorite things to do. Not only is it fun and I can turn on music or a ball game or whatever and just enjoy the sunshine, enjoy the beautiful warm weather, right? But also being in the water, oh my gosh, it's literally one of the only times in my life where I don't want to say I don't have any pain, but it's as close as I'm probably ever going to get. Being in the water takes so much pressure off my joints, so then that allows my muscles to relax. All of that in totality, just floating in warm water and being able to swim, dude, that's like one of my favorite things ever. And the more that I do that, the better I feel. And the more I can continue to swim and do those things, right? So there's so much that I have to do just on a day-to-day basis to try to prevent things. And then if I have a flare-up or if I have an injury or something that comes along that's going to then require imaging and physical therapy and follow-ups with all of that, following through all of those things and making sure I am doing what I need to. So listing all of those things that I do all of the time, it's, again, not to try to get anybody's sympathy, that's for sure. But I do list it so that way people can understand what not only I go through, but so many of us with chronic illness and disability go through. There is so much that we have to do just on a day-to-day basis just to try to make it through our day and to try to make sure that we can continue to keep making it through our days. Because I don't know about anybody else in the chronic illness or disability communities, but there's a lot of days where I feel like my condition has already taken so much. It's taken enough of my life that I am not willingly going to just hand over more. I don't want to give up more mobility. I don't want to give up anything else in my life. And so I make a series of decisions each and every single day to try to do what I can to keep my chronic illness at bay and prevent my disabilities from getting worse. And so being lumped in with the same community as fat acceptance and fat liberation, knowing that in the vast majority of cases of obesity and morbid obesity, that was also a series of choices. I understand that there are conditions out there that make things more difficult to lose weight or make it easier to put on weight. I understand that there are medications that do make things very difficult out there for people. I really, truly do. But I also understand the series of decisions that I needed to make in order to become 360 pounds. I know this series of decisions that so many people have told me who have also reached very large weights and then either turn around and lost the weight or realized that they did at least need to lose the weight and that they had the ability to then make better decisions and turn around and change the very things that they were doing wrong in their life. All of those decisions that led them to be, in my case, 360 pounds and unable to tie my own shoes. So knowing that I am fighting each and every single day to make the best possible decisions in my life to keep the quality of life that I have for as long as I have. And then I see a group that is just willing to give up and give in. I just don't want to be lumped in with that group. And I don't want to be used as some sort of prop, nor do I want their pity. And again, I understand that there is some overlap and that we may have some things in common, like for example, with accessibility or mobility issues. But I also understand the difference between something that has happened to someone versus someone who made that choice. And that might be a little harsh for me to say. That might be a little harsh to hear. But from my perspective, that is the reality of things. So I know I've talked a number of times on here about my grandpa, and he was blind, right? Well, my grandpa, after he retired, he became very active in our local blind society and blind center, and they actually had a workshop there, and my grandpa would volunteer his time up there to teach blind and visually impaired people carpentry and woodworking skills, right? And I could just about imagine what my grandpa would have thought, what he would have felt. I mean, I could probably predict something he would have said, but if he would have ever found out any of those individuals that he had helped at the blind center were blind by choice, that they had willingly done that to themselves, I could only imagine what he would think or how he would feel, knowing that he never had that choice, knowing that he told me flat out that nobody would ever choose that he didn't want people to feel sorry for him, that he was going to make the best of his life no matter what his life was. But he fully admitted that nobody would ever actually actively choose that life. So if he had found out that somebody he had helped up at the blind center had chosen that life, I could just about imagine what he would think or feel about that situation. Again, I could probably predict something he would say because he said this a lot anytime he heard something outrageous. So, stop the world. I'd like to get off, please. So I'm certain that my grandpa would have a lot of thoughts if he came across somebody who was disabled by choice. And that is why I have such an issue being lumped in with fat acceptance or fat liberation or whatever you'd like to call that group. Because us chronically ill and disabled individuals, we never had that choice. We never had a series of choices that led us to our disability. These were things that either just happened to us or we were born with. It just is. However, nobody is born 200 pounds overweight. Nobody is born morbidly obese. That is a choice, or at the very least, a series of choices that you are continually making on a regular basis. So trying to lump those two groups together, again, I have to wonder, why on earth did she bring up chronically ill and disabled people?
Is it that they should do anything absolutely possible to become healthy, even though they'll be chasing the health marker and the health marker will continue to move?
What? Yes, I will continue to pursue health, even if I might never be healthy because my collagen's a little jacked up in my body, right? Of course, I'm going to continue to pursue health because here's the deal. I'm still always going to have Ehlers-Danlos syndrome. There's no cure for it, so I'm always going to have it. However, if I didn't lose the weight, I'd still have the Ehlers-Danlos syndrome and, the other conditions that go alongside it. But then, I'd also be morbidly obese, and then I'd have pre-diabetes or probably full-on diabetes at this point. My PCOS would be through the roof. Who knows if I would have even been able to have had children, okay? So, yeah, I get it that I'm never going to fit this definition of healthy because, again, my body is what it is, but I can absolutely still pursue health. Losing 180 pounds, I'm no longer on blood pressure medicine. I'm not pre-diabetic anymore. My PCOS, I haven't had symptoms with it in years. I have 2 beautiful children. So what? Should I have not pursued health and I just let all of my ailments stack up? Am I just supposed to give up because I'm never going to be, quote, healthy? Of course not. I'm going to take a page out of my grandpa's book and I'm going to play the hand that I was dealt to the best of my ability. I'm not going to worry about what is or what isn't. I'm just going to live my life the best that I can. And then she's talking about chasing health markers that are constantly changing. Like, What on earth is she talking about? I am genuinely confused by that statement right there, because health markers are health markers. Blood pressure is blood pressure. If your blood pressure is 120/80 or higher, you're going to be treated for high blood pressure. Your cholesterol is your cholesterol. And if it's above or below certain markers, they're going to go ahead and talk to you about that as well. The only time that there might be changes to these health markers is if people age. So I really do hope actually we are chasing the health markers that change as we age, because that means we're trying to pursue a long and fulfilling life, right? What the health marker that might change, is she talking about weight? Is that what she's talking about? Because even if my weight changes, what a healthy weight is for my height, that doesn't change. So the health marker doesn't change. Again, I'm really confused by that statement and what she said there. And then she talks about pursuing health at any cost. So when she said that, I can't help but think once again of my grandpa. And yes, I got another grandpa story. He's just that awesome. I love talking about my grandpa. So buckle up, another awesome story about my awesome grandpa. So this happened in, I believe, the mid 70s. It was in the 70s and before I was born. So the exact year, I can't quite remember. You'll have to forgive me. But my grandpa willingly signed up to have one of the first cornea transplants done in this country. He knew it was very experimental. He knew the risks. He knew the recovery, which I'll detail here in a second. And he knew that the likelihood of it actually working was incredibly slim. But he did know that there was a slight chance. So my grandpa signed up for this surgery knowing that his recovery was about to be this. And I still have trouble wrapping my mind around this. I know the story and I still am flabbergasted by it, right? So after his surgery, for 1 month, for 30 days, my grandpa had to lay flat on his back with his head packed with sandbags. He was not able to move at all. He was not able to move his head from side to side. He wasn't able to move his eyes. He was not allowed to move. He was allowed to lay on his back and stare up towards the ceiling for 30 days, head packed in sand. It makes my skin crawl just thinking about this. And he willingly signed up for this. He willingly signed up for this surgery, knowing all of the risks, all of the potential bad things that could come from it. And unfortunately, it did not work for him. It didn't just not work, it completely failed and took with it the remaining vision that he had out of that eye and left him with a fair amount of scar tissue that he had to have an iris tattooed over, so it still kind of looked like an eye afterwards. Cornea transplants now, far more successful. There have been so many people who have regained sight or gained the ability in the first place to see. All because somebody like my grandpa was willing to try an experimental surgery alongside those trailblazing doctors. But if it weren't for people who were willing to try to pursue health at any cost, we would not be where we are now. So, again, I'm going to stick with my grandpa on this one. I'm going to take the page out of his book and not some random person on the internet who is trying to use disabled people as some sort of gotcha moment.
So I don't know why we're sitting here like the only thing you need to have and the best thing that you can have is your health.
What? What's the alternative? If you don't have your health, or you have no health at all, why don't we ask my dad about it? I mean, maybe our friend can pull out a Ouija board and get an answer from him. Because without health, my dad ended up in an urn. So, now I'm not saying it's like the only thing that you need to have. And I mean, nobody else said that except for our friend here. Unless there's some comment that she's responding to that she didn't bother to mention until now. Nobody said that except our friend. But without your health, kind of makes life incompatible. So again, what's the alternative? Like, and then again, she's going to bring up chronically ill and disabled people in this whole mess, right? So as a chronically ill person, and again, not a monolith, but just speaking from my own experience here, when my health isn't doing well, things aren't really going well in my life. I have to be honest. It messes with everything. It makes my anxiety like go crazy. My pain goes through the roof, and anybody who's ever dealt with chronic pain, like, it's not really pleasant to deal with, right? It makes it really difficult or impossible to do the things you actually enjoy doing. And then, you've got all that anxiety going on in your head. So all you do is just sit around thinking about all the things that you're not doing and all the things you're missing out on. So, like, again, what's the alternative? Like, I get it that I'm never going to have a clean bill of health. Okay. I get it. She's made that abundantly clear because, chronically ill people can't be healthy. Right. What's the alternative? Like, what is the alternative? So, like, I'm just supposed to give up my health because I'm never going to have a clean bill of health anyway? I'm just supposed to give up? What is her alternative here? If she doesn't want to have weight loss surgery, she could have easily been done with this video. She could have said easily, hey, it's not for me. If you want to weigh the risk versus the reward and you choose that route, go for it. We all have bodily autonomy. How long did that take me to say? 7 seconds? Come on. But all of this was unprovoked because Remy Bader had weight loss surgery. And then when she assumed people's motivations, and then the people who actually have the experience corrected her and said, hey, it wasn't because of that, you're mistaken, she just keeps doubling down more and more, bringing in chronically ill people, bringing in disabled people, telling us you're never going to be healthy, so why does it even matter about your health, right? If she doesn't want to have the surgery, that's all she had to say. She doesn't have to project all of this onto everybody else.
Because what does that mean? How many of you are sleeping 8 hours a night?
Okay, so of all of the health promoting behaviors that I listed earlier, she went straight to sleep. I love it. Let's go to the one that requires absolutely no effort except laying down.
How many of you are waking up and having breakfast?
And then getting up and eating. Let's sleep and then eat, because that's the most healthy thing you can do, right? It just cracks me up that that's exactly where her mind went to. Of course, sleep, very healthy, very necessary. Of course, breakfast, wonderful, if that's your thing. Not everybody eats breakfast. I don't always eat breakfast. Sometimes I wake up and my stomach is just not having it that day. Sometimes I wake up and I'm not really hungry, or I've got other things that I'm doing and I just kind of get busy with that, and then I get to lunch eventually. So this idea, are you eating breakfast? What kind of breakfast are we even talking about? Like, honestly, like, is she eating scrambled eggs, or is she rolling out of bed and eating a couple of donuts or a couple of pastries and having dessert and calling it breakfast?
How many of you are drinking as much water as you're supposed to be drinking?
And again, of all the health promoting behaviors she could think of, we went straight to sleeping, eating, drinking.
Also, we are not living in the same world where like fascism is tearing us all apart. So I think for me,
okay, is she going to address maintaining a healthy weight? Is she going to address exercise? Is she going to address any of the other health promoting behaviors we can do? Nope, she went straight to sleeping, eating, drinking. And now we're talking about fascists. Like, I can't even keep up at this point. What on earth is she going on about?
Me having a conversation about like, I got weight loss surgery because I'm the best, healthiest I've ever been. Not just because I didn't want to deal with fat phobia.
And again, that's not what people said. They did not say it wasn't just because they didn't want to deal with fat phobia. The comments that I read, fat phobia wasn't even a part of the equation. It wasn't even a thought in people's minds. So this idea, it wasn't just because of that. She's still trying to justify her response to all of this. She's still just trying to double down and use all of us as pawns in her mission, evidently.
We are missing the point. We're missing the point. So yes, I did.
The irony. The ultimate irony.
say like people would rather potentially die from weight loss surgery than deal with the ramifications of fat phobia. And a part of those ramifications of fat phobia is people constantly talking about your health.
Oh, like what she just did with chronically ill and disabled people. Like I said, they don't want people talking about their health, but they will absolutely bring up the health of chronically ill and disabled people any chance they get to try to prove their point, because they don't actually care about our health. Not at all. They don't care about my quality of life. They don't care if I'm living a wonderful life free from harm. She doesn't care about any of that. She's just using me and everyone else in this community as a prop. And it is literally so infuriating. I'm a person, as is every chronically ill and disabled individual. They are all people. So I'm not really sure why the thing that she is asking for her community, for fat people, right? She is unwilling to give to chronically ill or disabled people. All while she is still conveniently sidestepping that false dichotomy that set all of this up in the first place. The idea that people would risk the surgery and potential outcomes of that, including, as opposed to dealing with the ramifications of fat phobia. That's the only reason anyone would ever choose to have surgery, despite the fact that everybody in her comment section said that was not at all the reasons why they did it. She is still stuck on this. She cannot wrap her mind around the idea that people would lose weight for any other reason other than that. Because it's becoming very clear to me that I don't think our friend can even fathom any reason why somebody would choose to lose weight other than fat phobia. She simply cannot process that, and so she is just projecting it on everyone else.
Health policing, etc. And also even the own internalized fat phobia of blaming things that happen to your body on being fat. Classic example. If your right knee starts hurting and your immediate response is, my right knee is hurting because I am fat.
Okay, but what if it's your left knee? I'm sorry, the way that she has worded that is just really comical to me.
You're missing the in-between things, and you're...
So if she's only looking at the in-between things, isn't she missing the big picture? I mean, realistically, why would you look for the in-between things without looking at the big picture? So when you're trying to get any sort of diagnosis, whether it's an injury or an illness or whatever, it's always a process of elimination. They're going to have to try to remove as many variables as they can. So, for example, if you put on 20 pounds and while you are putting on those 20 pounds, your knee starts hurting, it would be a very logical conclusion that that additional weight is causing pain in the knee. Now, that doesn't mean that that's the only thing that could possibly be, but that's going to be the variable they're going to try to seek to eliminate. They're always going to try to remove as many variables as they can when they're trying to make a diagnosis. Like trying to get a diagnosis for Ehlers-Danlos syndrome, that was like the whole name of the game. They had to remove all the variables and then start eliminating things. So you got to start with the big picture and then you look at the in-between things. So it seems like she doesn't even want to look at the big picture.
Also missing the point that a lot of thin people also have knee pain. They're not fat. So if they're not fat, why do they have knee pain?
It's not because they're fat. There's other things it can be. And I understand that not everyone who is fat who has knee pain is because they're fat. But they're not going to tell somebody who is thin that they have knee pain because they're fat. I mean, this is such basic logic. I don't understand how she can't even figure this out. I thought this was all a question of what healthy is. And now suddenly we're talking about knee pain and why thin people wouldn't be told that their knee pain is because they're fat. Because, they're thin.
No health ailment is specific to fat people.
Oh, I bet she really thinks she did something there, huh? So no health ailment that she is aware of is specific to fat people. However, that list of ailments that I had earlier, there was one in there that definitely is caused by being fat. Obesity-induced asthma. It's kind of in the name. The obesity induces the asthma. And the thing about that is it's very different than traditional asthma. The symptoms might be the same, but the mechanism behind it, completely different. So traditional asthma, all of it comes from internal. So you've got inflammation and constriction coming in the bronchial tubes, actually preventing the air from getting into the lungs. Where with obesity-induced asthma, your lungs aren't expanding. That's accurate, but it's from external forces. I had so much visceral fat built up on my chest, my lungs couldn't expand properly any longer. It's an entirely different condition. Different treatments, different mechanisms that drive it. They are very different things. So yes, there absolutely is an ailment that is specific to fat people. This honestly sounds so much like when smokers try to justify that, well, there's other people besides smokers that get lung cancer. Okay, yeah, that might be accurate, but come on, we know the risks. Let's just be real. So there's our friend's response to all of the pushback that she did receive. And gotta say, it doesn't sound like she's actually listening to understand or learn at all. It really just seemed like she used this as an opportunity to further push her rhetoric. So let's go ahead and check out these next TikToks. And these are going to be discussing Ehlers-Danlos syndrome. And we'll go ahead and go through these and I'll give you my reactions along the way. Okay, and this one says, symptoms I thought were normal, but were actually Ehlers-Danlos syndrome. Getting hiccups all the time. I don't necessarily get hiccups all the time, but I'll get like just a random like single hiccup, like just out of nowhere. So I do get that, but not hiccups all the time. But again, there's a lot of overlap, but then there's a lot of just like random things that not everybody gets with EDS. So shaky hands and twitchy eyelids. Yeah. She says on here, eyeliner is impossible. This is why, honestly, I pretty much exclusively use eyeshadow and a liner brush, because if I'm trying to use any liquid, forget about it. And then pencil, like I end up with really thick eyeliner when I use pencil, just because, again, yeah, shaky hands and twitchy eyelids. Yeah, definitely get that. Constantly hurting, dislocating joints in my shoulders, ankles, and knees. Oh boy, yes. Oh my goodness. Okay, so I just actually went out this week and was doing a bunch of yard work on Sunday. It's now Thursday when I'm filming. So I went out Sunday and did a bunch of yard work, did the trimming and the blowing and some general cleanup in the yard, right? By the time I got done, all I did was one step. All it took. And I could instantly feel it. I felt a tendon or something. I looked it up afterwards. I'm pretty sure it's a tendon, but I felt a tendon like totally tighten up in my ankle, and not just tighten up, but subluxate. It's a partial dislocation, but it literally, my tendon popped out of place. Real super fun. And when that would happen, like anytime I would take a step when my tendon was out of place, I literally lost all of the strength out of my foot, my ankle, my knee, like the whole right side of my lower body. I just lost all the strength out of it from one tendon. So yeah, I can definitely relate to that. And I gotta say, that was the good ankle, not the one that I've had reconstruction surgery on. So a little disconcerting that I had another tendon messed up in an ankle, but at least it does seem to be on the upswing as of today, thank goodness, because I have had the last 3-4 days of me propping it up, keeping it all wrapped up, putting ice on it, just trying to do everything I can to get it back to normal. I literally even had to break out my cane this week, but I will say it definitely did help, and I am finally on the upswing. But yeah, ankles, shoulders, knees, absolutely terrible. We'll go ahead, throw into that my hips. They pop and pop out of place quite frequently. My fingers have dislocated more times than I ever care to mention. And ribs pop out quite frequently on me. And that one, oh goodness, it's always disconcerting when it happens. I'm kind of used to it now and generally know how to pop it back into place. But there is something very disconcerting when you feel a rib just kind of slide out of place right in your midsection. Feeling cold when no one else is. Yeah, that's accurate, but also that's not just my EDS. That also came along hardcore after I lost weight. I'm cold like all the time, like all the time, unless I'm literally in the shower under steaming hot water, in a warm pool, or buried under the covers in my bed. There's a real good shot I'm cold. Feeling hot when no one else is. Again, I haven't experienced that since I've lost weight. I will probably live to regret this, but I think I am probably the only woman in existence that is actually looking forward to hot flashes because I am that cold all the time. Okay, tooth chipping, jaw pain, and gum issues. Well, I did just happen to have an emergency root canal not that long ago. So yeah, dental issues are a real problem with EDS. One of the other things that can come along with it for sure is TMJ, or just laxity in your jaw muscles. So this was about 7 or 8 years ago. I had to have a mole removed right down here in my lower jaw. And unfortunately, that removal completely dislocated my jaw, and it hasn't been quite the same ever since. It's not as bad as it could have been from what I've understood from other individuals who have had jaw dislocations, but still is not fun. I don't recommend, and I don't want to go through that again, please. Nausea, reflux, and IBS-like symptoms. Well, IBS. So I guess that would be IBS-like symptoms, right? But yes, digestive issues can definitely be a problem, and there's definitely multiple issues that we can have alongside that too. Now we're on to symptoms I thought were normal, but were actually Ehlers-Danlos syndrome, part 2. Heart palpitations. Oh yes, oh boy, have I had a lot of heart palpitations. I've had to wear 2 different heart monitors actually. One was like a 3-day monitor. I think it was a Holton monitor is what they called it. The other one I had to wear for 30 days. And that was actually when I found out I'm allergic to adhesive, because the little stickers you have to wear for the sensors for the heart monitors, oh boy, I ended up with welts everywhere where I had to put them. And like legitimately, those welts lasted probably 2-3 months afterwards. So yeah, found out there are benign heart palpitations at the end of all of that, but I also did find out I've got an allergy to adhesive. So you win some, you lose some, I guess. I don't know, I'm trying to find a win here, right? Every bone in my body cracking all the time. Oh yes. Oh my goodness. Okay, the best one to crack in my body. I honestly have a hard time sometimes cracking my knuckles. A lot of people are really adept at cracking their knuckles and can do it like 3 different times on one finger. I have issues cracking my knuckles, so I don't do that too often. But my right foot, I don't know what it is. If I flex my right foot, just literally like pop it up onto the toe, every single bone in my foot will crack. And you don't realize how many bones are actually in your foot until you feel all of them crack at the same time. It sounds like Rice Krispies, but I swear, it's just my foot. Ah, yes, dizzy spells. I have unfortunately woken up on the floor just a few too many times, so I can confirm that dizzy spells are very common. Bruising easily. Oh gosh, yes. Sometimes all I have to do is just brush up against something or bump up against something and then forget about it. I'm bruised. The worst bruise that I can ever recall, I do believe, is actually after I had that molar removed out of my jaw. It was after I had had a tooth removed, right? And this was when I was back working 3rd shift at a gas station. So I had stayed up like the entire night previously just to go have the dental work done. And then when I got out, my husband was going to be watching the kids the rest of the night. So I took the painkillers they gave me. And I remember I literally laid on my right side for like, I think like 18 hours or something ridiculous between just being absolutely exhausted from my job and then the painkillers. I didn't move that entire time. My husband literally came up to like check on me, like get me to go to the bathroom and like feed me and stuff. And after that 18 hours, the entire side of my body, we're talking literally from my waist almost to my knee, the entire outside of my body, black. Absolutely black. It looked like somebody took a baseball bat to me. I'm not even joking. I knew that didn't happen. I know I didn't even fall out of bed, because even as out of it as I was after that, if I would have fallen out of bed, somebody in the house would have heard me. And no, it was just literally that I laid on my side for so long, the blood pooled enough that it eventually caused a massive bruise. And I even ended up going to the ER to get it checked out just to make sure I didn't like have something going on, like internal bleeding or something. And they were all tripped out, like, are you sure nobody took a baseball bat to you? And I'm like, yeah, I'm pretty sure that's something I would recall. And that was the only thing that we could come up with, was that I just laid on my side for too long and it caused a massive, crazy bruise. So yeah, easy bruising. Oh yeah. Weird thin scars that open up a lot. So I don't necessarily have thin scars. What I end up with are on the other side. You can, with EDS, end up with very thin, papery scars. The other side to it is you can end up with keloid scars, and that's exactly what I get. So they are very thick, they are raised, they are red, they are angry. They don't ever really fade. Sometimes they might go to a little bit of a whitish, pinkish color, but they're always there, present as a scar. And at least like my ankle surgery, that's the biggest scar I have on my body right now. And it's still 10 years later, it's still very, very sensitive. I have to be so careful what shoes I wear so I don't rub up against that scar. And maybe because I am so careful about that, I haven't had issues with it reopening, thank goodness, because that doesn't sound pleasant. But even just something as simple as like when I was doing that yard work on Sunday and messed up my ankle, I was wearing my rubber garden boots outside. And those rubber boots were rubbing just enough on the scar that I could not wait to come inside and rip them off so nothing else was rubbing against my scar. So all that to say, many of us with EDS do have abnormal or atypical scarring at the very least. A narrow upper palate causing teeth crowding and speech issues. Now, I do not have this, and from my understanding, this isn't always applicable to all subtypes of EDS. So with Ehlers-Danlos syndrome, there are 13 different subtypes of EDS. The one that I have is called hypermobile EDS, and that accounts for, I believe it's like 80% of cases of EDS that are diagnosed. So there, again, are 12 other different subtypes. And I want to say this is more a sign of a different subtype. I could be mistaken. I just know that this is not something I personally have dealt with, so it could again apply to hypermobile, but I'm almost positive it's more for classical or vascular EDS. I want to say it's classical, but again, there's a lot of different subtypes, there's a lot of different overlap on that, but that is thankfully one I did not have to worry about when it came to dental issues. Muscle cramps. Oh boy, I can't even begin to tell you how many times my muscles will just cramp up on me. I'm not doing anything, and then all of a sudden you just get a Charlie horse in your leg for no reason. Well, okay, with EDS, it's not really no reason. It's just not the reasons you would typically assume. I guess that's probably the best way to word it. So one of the things that happens with EDS, especially with hypermobile EDS that I have to deal with, your connective tissue just does not work properly. Your collagen does not work properly at all in your body. So because of that, everything that is made of collagen can be affected. So with hypermobile EDS, that's going to be your tendons, your ligaments, your cartilage. It's also going to be your hair, your skin, your nails. It's going to be your blood vessels. It's going to be your eyeballs. It's going to be the synapses of your brain. It's going to be your nerves and your spinal column. Like, it can affect literally so many different things. But when we're talking about specifically with muscle cramps, you have a lot of laxity in your connective tissue. You have very loose joints, essentially. So your tendons and your ligaments don't hold your joint together the way they normally should. And oftentimes that means your muscles are going to be doing double, maybe triple duty just to kind of hold yourself together. And your body continually having to fight to hold yourself together, eventually it can fatigue and give you a ton of muscle cramps. So when you think about it that way, it does make sense. It's still just rather unfortunate when you're just sitting on the couch and all of a sudden you get a Charlie horse in the middle of your leg. It really is unfortunate. And then, like, let's talk about the other muscle cramps, of course, being a woman. Period cramps, they can take me out. They absolutely can. It's ridiculous. Be honest, I'm fairly certain that I have endometriosis alongside of it, but trying to get that diagnosis is about as difficult as trying to get an EDS diagnosis. So here I am with no diagnosis. At least I got my EDS one, but fairly confident I have endometriosis alongside of it. My goodness, is it no joke? No joke at all. There's been times where I swear to you, it's just as bad or sometimes even worse than what I felt when I was in labor. So yeah, muscle cramps, definitely no joke, and yeah, affects a lot of us. Okay, in this next one, remembering that my faulty connective tissue causes me chronic pain, but at least it makes me look way younger than my real age. Okay, so yes, looking younger than our age, I will say that is probably the one benefit that I can list from EDS. Everything else you just kind of deal with or get used to. That's one benefit, I'll definitely say. So kind of going back to the difficulty with scarring, and then many of us will have sensitive skin as well. A lot of us also have very smooth, soft, velvety skin. That's actually one of the diagnostic criteria, is smooth, velvety skin. So not mad at that, honestly, really not mad at that. I'm 41 and I've had a lot of people tell me, and don't look my age. So I have to believe that's the EDS.
You're hypermobile. Does vacuuming literally hurt your hands because you grip the vacuum so tightly? For the longest?
Not necessarily vacuuming, but anything I have to grip. Literally anything. I do the death grip because I'm so worried that my hands are going to fail me and then I'm going to drop whatever I'm holding, that it's just become an instinctual thing now that just grip everything so tightly. So I like to sit and color a lot with my kids. They still love their coloring books and their crayons, their markers, colored pencils, right? And I will sit down with the coloring book and the crayons and join the kids and take a load off for a little while. And I can't tell you how many dang times I'm sitting there coloring and all of a sudden death grip and that crayon is now in 2 pieces. Oops. Or like, for example, this morning I went ahead and was able to finish mowing and finish the rest of my yard work for this week. And while I was out there mowing, every single week I have this issue. It's like I'm 3/4 of the way done mowing and I can feel it in my hands, in my wrists, all the way up to my elbows. And again, it's the death grip. I am gripping the lawnmower so tightly, especially like the bar or the self-propel, all the other things I gotta grip and make sure I don't let go of, that by the time I am done, everything hurts. Absolutely everything hurts, from my fingertips all the way past my elbows. So yeah, death grip, I can definitely relate.
I've worn gloves while I vacuum and do things around the house, and I just recently realized this is why. These are my vacuum gloves. I have 2 pair that I wear. These are fingerless. They're, I guess, technically for working out. And then these, because the grippies also, I don't feel like I have to grip things as tightly, and then it protects my hands from rubbing against the vacuum, because again, I always end up with like my hands torn apart. Anyway, I hope that helps.
Yeah, that actually is very helpful. I will definitely admit I've got gloves for pretty much everything. To be fair, some of that actually started before my EDS diagnosis, simply because I like my nails. And if I don't keep my nails and my hands protected, my nails are absolutely going to crumble. Now I know that's actually part of the EDS because I have very weak peeling nails. And again, hair, skin, and nails are all affected by your collagen, right? So yeah, my nails really suck. So I started years ago wearing dish gloves. Just that act alone made a huge difference. Now I've got gloves for like everything. I've got gloves for all my yard work. I've got gloves for pruning. I've got like 4 or 5 different pairs of gardening gloves, and all of them have different functions. I've got, like I said, my dish gloves. I've got gloves to clean with. I've got my kitchen gloves to touch food with. I've got gloves for everything. And then you get the added bonus of it can help keep your nails nice too. So yes, gloves, quite helpful.
I have to know if you can do this. Can you do this? Pinch your fingers, okay? Normal pinch, just pinch them together, okay? And then you're gonna turn them without taking them apart. Pinch, turn. Can you do that? Is this just, am I just weird? Where are my bendies at?
Okay, yes, that's correct. That's not normal. Not at all. That's a sign of hypermobility in your hands. There's plenty of signs of them, like being able to bend your fingers back, being able to bend your wrist all the way back, things like that. So one thing that I found out that I can do that I know is definitely a sign of hypermobility in your hands as well, I can literally cross all of my fingers without using my thumbs. So like this is my first finger and my pinky crossed back here. And being able to even touch your fingers together like this, your pinky and your first finger like that, that is a sign of hypermobility in your hands. But I can go ahead and even cross them. So there's other parlor tricks or bendy tricks, whatever you want to call them. There's other things I can do, like bending over to touch my toes. That is absolutely no problem still at 41. I don't just touch my toes. I can literally put my hands completely flat all the way between my feet. And then I can walk my hands backwards probably about 2 feet. So that way I'm folded up totally like a pretzel and my head is like all the way between my knees. So yes, I can do lots of bendy tricks or parlor tricks or whatever you want to call them. However, I highly advise against it if you can help it. Try, if at all possible, if you are noticing hypermobility at all in your body, try to stick with a normal range of motion. Just because you can doesn't mean you should. Unfortunately, you never know if that's going to be a time where everything goes perfectly fine and you're okay, or if that's going to be the time it might cause an injury. So the older I get, the more that I realize I am paying for each and every single day. All of those party tricks I could do, all of my double jointedness or extra bendiness that I had, I'm paying for it now with extra pain and extra stiffness. So my advice to people is it's okay if you can do these things. Definitely talk to your doctor about these things, but try as much as you can to stick with a normal range of motion, and definitely don't skip out on physical therapy if you need it, because at 41, I can legitimately feel all of the tricks I ever tried on my body. You can also feel all of the falls and injuries and everything else I've ever done too. But just because you can doesn't mean you should. But maybe that's just me. Let me know down in the comments below. What do you think? I'm genuinely curious and I love reading all of your responses. And if anyone has any further questions about Ehlers-Danlos syndrome or my experience with it, feel free to leave them down in the comments below and I'll do my best to either respond in the comment section, or if there's enough questions, I'll do another video. That is where we leave things today. I thank you so much for joining me. Please be sure to like, share, comment, and subscribe, and I will catch you all in the next one. Bye! It's Tony time. That's right. Normally we have Pokey at the end, but today we have Tony. Yes, that's right. And then we have a third kitty. We have another long-haired tortie. Her name is Penny. And oh, here comes Pretty Penny right now. She came in squeaking and is probably going to make Tony very upset. Pretty Penny, unfortunately, I cannot pick up at all. She hates it. And Beyond just hates it. All 3 of my kitties we actually adopted from the Humane Society as adult kitties. And they all, have their own little backstories and their own little personalities. Like Miss Tony here, she was a surrender, so we're not really certain like her whole backstory, but we know she at least came from a house and she appeared to be very well loved. And then Pokey, she was found behind a dumpster all beat up and somebody brought her in to get her some vet care, and then we were able to adopt her and get her home. And then Pretty Penny, she was also found beat up behind a dumpster, but she was in really, really bad shape. She had to go through a lot to get where she is now. So they got her all fixed up, and they found in getting her fixed up that she had a chronic infection whether it was from that time or just in general from her being on the streets. She ended up having to have over 30 days of antibiotics injected every single day, poor girl. So she went from no contact with humans at all, being a street kitty, to now getting picked up, getting veterinary care and getting taken care of and everything she needs to. But at that point, she still hadn't really had a whole lot of good touches. I mean, obviously the veterinary staff and the people at the Humane Society were doing all they could for her, but she still wasn't used to affection from humans, right? So when we first brought her home, it took about 9 months or so for us to even be able to touch her. She would literally hide behind the toilet in my bathroom and growl and growl and growl at you. And if you've never tried to use the bathroom with a cat growling at you behind the toilet, I can't even begin to describe the primal fear that it unlocks. Literally trying to just go use the bathroom and then worried this cat's gonna rip you a new one. Literally. But, we gave her time, we gave her space, and she never did anything other than just, kind of let us know she was there from time to time. And after about 9 months or so, she started coming out more and more and more, and we started being able to play with her. And then once we started playing with her, she started letting me touch her every once in a while as she ran by. And now, about a year on past that, this kitty is a doll. Penny is such a doll. She is such an affectionate sweetie pie, and she's obviously still getting used to things, but we still cannot pick her up because, unfortunately, with that infection that she did have that they had to give all those antibiotics for, it left her with a permanent head tilt. So Penny will come, just stare right at you, and then just tilt her head and look all inquisitively at you. And it's adorable. Absolutely adorable. They did tell us, though, that that was a benign head tilt. And unfortunately, we found out it's not entirely benign. I mean, it is in the idea that it's not actively hurting her, but it does have some neurological effects, unfortunately. So this kitty has no balance. Miss Penny has absolutely no coordination. She doesn't know how to cat. That's the only way I know how to describe it. So she's afraid to jump up on things. If she comes down the stairs too hard, like she has run right into the wall at the bottom of the stairs because she couldn't take the corner fast enough. And yes, I laughed. It was funny. She's fine. So we could all laugh. It was funny. But because of that, the most I've ever been able to really do is kind of just like put my hands under her belly and give her a little scooch or a nudge, trying to actually pick her up. Oh no, she is not happy. I'm actually a little worried that if I did pick her up, she wouldn't know how to handle it, because I will say that I did pick her up one time. I got her not even as high up as I'm holding Tony right now. I got her just about at the knees, and she tripped out. So I was like, okay, obviously we're gonna put her right back down. And I went to go set this kitty down. Now I'm telling you, she was like 2 inches off the floor. All she had to do, set her little paws down, and she would have been soft landing, right? Perfect, happy landing. No, somehow my pretty Penny ended up tripping out, flipping out, ending up on her back, and not a single paw ever made it to that floor. So, again, yes, I laughed, and she was fine, so it's okay to laugh. But unfortunately, we cannot pick up Pretty Penny. So I wanted to introduce you guys to Pretty Penny, or as I ask her every morning, is she going to be Penny Lane or Pennywise today? Never know which Penny we're going to get, but she is a sweetie pie and she is a doll. But she does like to antagonize Tony. And at this particular moment, Penny is at my feet and Tony is kind of agitated. So I have a feeling I'm going to set Tony down and we're about to have World War III. So, well, enjoy. Bye.